Welcome to day 4 of the Division of Workers' Compensation Healthcare Provider Bootcamp series. In today's training, we're diving into the ultimate obstacle course of knowledge, how to identify a workers' compensation patient. This is where we test your endurance and the groundwork starts. Our learning objectives will train you to spot those critical details to identify workers' compensation patients and verify you've registered them correctly to streamline the registration process and keep those billing denials at bay. This is where you need to stay sharp, stay fast, and stay ahead. This presentation will offer valuable insights into the Texas workers' compensation process and emphasize the importance of identifying workers' compensation patients from the very beginning of each encounter. We emphasize in all of our educational presentations that our goal is to inform and educate participants. This presentation is intended for educational purposes only. It is the responsibility of system participants to understand and comply with the relevant statutes and rules. These statutes and rules are used when resolving disputes or complaints, so it's essential to familiarize yourself with the Texas Insurance Code, the Texas Labor Code, and the Texas Administrative Code. Before I go over the overview for the presentation, I want to first talk about how workers' compensation is different. I included this slide because it's essential to understand how workers' compensation works differently in Texas. In Texas, when we speak of coverage, it's the employers who get the coverage, not the employees. Texas is unique because it is the only state that doesn't mandate its businesses to purchase workers' compensation coverage. Texas stands out from the rest of the country by allowing employers the choice to opt in or opt out of workers' compensation coverage, a flexibility not available in other states. If a Texas employer elects to have coverage, they also get to choose what type of coverage that they have. Think of it like choosing a healthcare plan. Texas employers can pick between different types of coverage, similar to choosing between PPOs and HMOs. This choice affects whether injured employees must be treated by specific doctors within a network, or if they can select their own treating doctors outside of a network. And I'll dive into more detail on that as we progress through the presentation. Typically, when a patient arrives for an appointment, they present an insurance card detailing their coverage. However, in the case of workers' compensation, coverage is determined by the employer at the time of the injury and the type of coverage that the employer has elected to choose. Another difference I feel is worth mentioning is the use of terminology in workers' compensation. The term claim refers to the injury or illness itself, not the medical bills. This is a crucial distinction to keep in mind. It's also important to point out that there are also strict timelines in workers' compensation billing. Unlike regular health insurance, which might allow months for billing submission, workers' compensation bills in Texas must be submitted within 95 days from the date of service. Any necessary corrections must also be made within this period as well, because the clock does not reset. In the dispute resolution process, if a carrier reduces or denies your bill, you only need to appeal once. Unlike regular insurance, where multiple appeals might be necessary, workers' compensation disputes in Texas are resolved through specific processes. So you want to keep that in mind when dealing with workers' compensation patients. Lastly, and most importantly, you want to make sure you never bill a workers' compensation patient directly. Defaulting non-payment to the patient can lead to administrative violations, so it's crucial to handle these cases correctly. Let's go over an illustration of all the types of categories Texas employers can fall into. Coverage is generally elective, and you will see that the Texas workers' compensation system does not include federal employers. First, you see here employers who have coverage divided into 3 categories. First, there are the subscribers. We use the term subscribers for Texas employers that have coverage in our system. These employers provide benefits to their employees by purchasing workers' compensation coverage through an insurance carrier. Then there are the certified self-insured. These are private employers approved to pay their own workers' compensation losses rather than buy an insurance policy. These employers are able to become certified to self-insure by applying with the Texas Department of Insurance, Division of Workers' Compensation. And then we have governmental employers. These are governmental entities like public schools, cities, or counties. They choose to fund their own workers' compensation program or join a pool with other governmental entities. On the other side here, we have the non-subscribers. These are the employers that chose not to provide workers' compensation coverage to their employees. These employers might only carry minimal coverage, such as accident policies, or even opt out of coverage entirely. Any employer who chooses to what we call go bare and forego workers' compensation coverage risks facing litigation from their employees, since they are not protected by the regulations that apply to covered employers. This breakdown highlights the flexibility and options available to Texas employers within the workers' compensation system. Now that we've talked about the differences, let's move on to the presentation. This presentation will include a slide presentation and then a live demonstration using our webpage to focus on 3 topics. First being the risks you take if you don't identify a workers' compensation patient. Questions to ask during patient registration and scheduling, because asking the right questions can save you valuable time and prevent the need for additional follow-ups. You may already have a workflow for when patients call in to schedule appointments, but it's crucial to recognize that workers' compensation cases require a different approach than those with general insurance coverage. And then how to verify the information you've gathered, where to navigate on our webpage, and what information can be found there, and where to find the additional resources available to make this process easier and more efficient for you. The risks of not identifying a workers' compensation injured employee can impact everything related to processing your bill. You may receive no payment if you miss billing deadlines. Meeting the 95-day billing deadline from the date of service is critical to ensure timely compensation. Missing this deadline puts you at risk of non-payment, so it's essential to stay vigilant and submit all bills on time. Additionally, some services require pre-authorization. Always verify if the treatments you plan to provide need approval beforehand. Without pre-authorization, your bill could be denied. Make it a habit to check pre-auth requirements for every service and meticulously document all verification details, including the contact person and any reference numbers. This proactive approach helps prevent costly denials and ensures smooth billing. I mentioned earlier employers having network options. In some instances, there may be a healthcare provider of networks that the injured employee must use in order to be treated for their injury. It's vital to verify if there's a specific network and confirm that your provider is authorized within that network to treat the injured employee. This ensures that you're being compliant, and it helps facilitate proper care for the patient. You also risk billing the wrong carrier. Billing the wrong carrier can be a costly mistake if you accidentally submit a bill to the injured employee's health insurance instead of the correct workers' compensation carrier. You'll only have 95 days from the date you were notified of the billing error to correct and resubmit it to the correct workers' compensation carrier. And remember, the process of gathering all the necessary information to make this correction can eat into that 95-day window, effectively pushing you back to square one. So you want to make sure that you stay vigilant to ensure you bill the right carrier from the start to avoid this time-consuming and potentially expensive error. And you could be out of compliance for billing a workers' compensation patient. Proper billing will help avoid potential legal and financial repercussions. It's essential to highlight that billing a workers' compensation patient can put you at serious risk of non-compliance. If you incorrectly bill the injured employee, you run the risk of an administrative violation for billing the injured employee for the work-related injury. A healthcare provider may not pursue a private claim against a workers' compensation claimant for all or part of a healthcare service provided, unless otherwise advised to do so. This is stated in statute 413.042 of the Labor Code. So who needs to know? All staff need to know that there is a workers' compensation injury being treated. From the moment a patient calls to schedule an appointment, the billing process begins. Each department's role in gathering information directly affects the next department throughout the patient encounter. A seamless flow of information gathering ensures efficiency and accuracy, making everyone's job easier and ensuring the patient receives the best possible care. Scheduling staff is the first step to gathering as much information from the patient as possible. Scheduling staff are key to gathering this important information. This is your opportunity to determine if the patient might have a workers' compensation claim and to verify whether the employer has workers' compensation insurance. This step is vital for deciding who should be billed for medical services related to the injury. If it's a network claim, this is the time to ensure your healthcare provider is contracted within the network prior to providing any care to the injured employee. The front desk staff is the next opportunity to verify important information with the patient. During check-in, it's essential to reconfirm key details, including whether the visit is related to a workers' compensation injury. Implementing a check-in form that asks if the visit is work-related can help obtain written verification. Additionally, inquiring about co-pays often prompts patients to mention that the encounter is for a work-related visit. It's just as simple as saying your copay is due today. That may prompt you to get the information that you need. Once the visit is confirmed as work-related, the front desk can gather necessary information, such as whether an adjuster has been assigned or if there are any updates since the appointment was originally scheduled. This is also an ideal opportunity to collect any missing information before the patient meets with the clinical staff. Ensuring all details are accurate and complete at check-in sets the stage for clinical staff. Once the patient moves to the examination room, the clinical staff should be informed that this is an injured employee. They should begin by gathering all pertinent information once again. It's extremely important that the clinical team provides the medically necessary documentation to support the medical bill, ensuring all details about the mechanism of injury, including where and how it occurred, are thoroughly documented. The clinical staff is also responsible for creating the treatment plan, managing referrals, and maintaining regular communication with other healthcare providers as needed. They must be aware of pre-authorization requirements and ensure written approval is obtained before administering any treatment. Additionally, they will be the ones setting the return to work goals for the patient, guiding them through their recovery journey. When the encounter reaches the billing staff, they should have the carrier information verified by the scheduling and front desk staff, as well as the treatment details and documentation from the clinical team. Additionally, they need any pre-authorization numbers or verification information obtained during the encounter process. The billing staff must ensure all charges related to the encounter are accurately billed and a completed medical bill is submitted within the 95-day window from the date of service. And then the accounts receivable staff should be able to determine the reimbursement amount based on the network contract or the DWC fee guidelines. Also, they need to review the explanation of benefits and interpret any claim adjustment reason codes. Additionally, they should be well-versed in the dispute resolution process for claims, knowing how to follow up and who to contact regarding any issues that may arise. Now, let's explore some suggested questions that can help you gather all the essential information to verify workers' compensation coverage. You want to be sure to ask these questions to every patient, and don't hesitate to ask them more than once if needed. And most importantly, you want to ensure you get these responses in writing. As I previously mentioned, Some offices may include a question on their intake paperwork asking if that day's visit is related to a workers' compensation injury. This approach not only ensures verification from the injured employee, but also serves as documentation in case there are any disputes that arise after billing of the encounter. Throughout the patient's visit, each department has the opportunity to ask specific questions about the injury. While these questions might be repetitive, sometimes the phrasing can elicit important responses from the patient. This repeated questioning ensures the information remains consistent and nothing is overlooked. First question should be, how were you injured? And ask, when did it happen? What was the date you were injured? Remember, coverage always leads back to the original date of injury. As you ask these questions, remember the golden rule. Document, document, document. Record the patient's responses in writing as the encounter unfolds. I cannot stress enough how many times I've heard providers say, well, they told me this, or I confirmed that, only for me to ask, did you? Where's the documentation? It always boils down to this. If it wasn't documented, it didn't happen. Ask them, where were you when you were injured? Or ask the patient directly, were you injured at work? And then ask, who was your employer on the date you were injured? And what was the date you were injured? Depending on how you phrase these questions might elicit different responses from the patient. Ask, does your employer have workers' compensation insurance? It's possible that HR has already reached out to them and informed them about the need to see specific doctors for their injury. Asking this question could unlock a wealth of information that the patient might already have. And you want to ask, are you employed by a public employer? And some examples of those would be school districts, counties, or states. You want to ask this question because when it comes time to verify coverage, these types of employers are found under a specific link. So having the answer to this question will be beneficial when looking up verification. Plus, this could be an indication that there may be a network contract involved as well. Some questions that may help you determine if there may be a network contract involved are you required to get healthcare for your work-related injury through a workers' compensation healthcare network? This can help identify if there are specific network restrictions or requirements in place. And if so, did they select your clinic or doctor from that list of network providers? Understanding whether the patient was directed to a specific provider can clarify if they need to see a network provider or if they have flexibility in their choice. These questions can reveal if there are any network constraints that could impact the patient's treatment options and your billing process. Now, you want to keep in mind that you might not be the patient's first encounter regarding this injury. You could be the referred to doctor or the next provider in line. Whether you're their initial visit or a follow-up, there are key questions to consider. Ask the patient if the insurance carrier has ever indicated that any part of their claim was questioned or denied. This can help you understand if there are existing issues with the claim. And you want to consider inquiring with the insurance carrier or the referring provider's office about any outstanding disputes related to the claim's compensability or the extent of injury. Knowing about any disputes can alert you to potential problems your office may encounter. Receiving payment and may indicate that your bill could also be challenged. By asking these questions, you can identify and address any issues before you bill the patient's encounter with your office. All right, so now we've asked the questions. We've gathered all the information. Let's go over to the website and take a look at how to navigate and where to go to verify coverage. You will see here that we are over on the Texas Department of Insurance website, and I took the liberty to move us directly under that workers' compensation tab here. You can either be under the insurance, the state fire marshal, or workers' compensation. This A through Z up here goes to the main Texas Department of Insurance website. So when we refer to workers' compensation A through Z, you always want to be down here and use this here for those A through Z lookups. So there are multiple ways to get to the same place on our website. One, I'm going to show you a couple of different avenues that's going to lead you to the same place because it's fairly user-friendly and it does provide you, it helps you get to the same place that you're looking to get a majority of the time. You can use TextComp here. The system that we use to verify this information is our TextComp system, and I'll click on that to show you. Seasoned people who look this up regularly are very familiar with this, I'm sure. I'll click on it to show you what it looks like. As we go through this process, you're going to see that we're going to come into the TextComp system, and this is where you get the information from. If you're unfamiliar with TextComp or have questions on that, there's a bunch of information here for you, along with a video down at the bottom, which shows you how to navigate through TextComp. For this demonstration, though, I am not going to use that. I'm going to use this right here. And the reason I'm going to use Verify Employer Coverage is because of this page. As you saw, when we went into TextComp directly, we didn't see this page. And this page is where that initial chart that we went over at the beginning of the presentation, all of those categories that these employers can fall into are now located here on this page and divided up for you. First, we have those subscribers. Those are the ones that are covered by a licensed Texas insurance carrier to cover their injured employees. The next one here is a subscriber, those certified self-insured subscribers. Remember, these are those private employers approved to pay their own workers' compensation losses rather than buy that insurance policy. I'll click here to show you what that looks like. When you click on that, there are 30 pages available here. You will see the name of the employer. You will see company contact information, who their TPA or their third-party administrator is, along with their Austin representatives. So if you do have a certified self-insured employer, this is where you're going to come to verify that information. The next one is those governmental entities. Those are those public schools, cities, counties, and remember, they chose to fund their own workers' compensation program or they joined the pool with other governmental entities for this one. This is why asking that question is important because this is where you're going to go to verify their information. This brings you directly into TextComp. This is where you would put the organization name along with the date of injury here. We'll go back. Directly underneath that is those non-subscribers. These are the employers without workers' compensation coverage. These are the employers that chose not to provide workers' compensation coverage to their employees. And you can click here to get that list of non-subscribers. What this brings you into is the Texas Open Data Portal. There is a new user guide here. If you're unfamiliar with this and you don't know how to use it, there is a bunch of information available to you for you, and even where to begin and how to set up an account as well. So if that is something you want to look into, that's very helpful to give you the user guides. But this is where you get those employers that chose not to have workers' compensation coverage, and this is where you would verify their information. And then underneath here is the unknown where you would email us. For this demonstration, I am going to use this, the subscriber one here for those covered employers. And we're going to click, which is going to bring us over to this main page. You hit accept, which brings you into this. Now this system can be a little wonky. We're going to go through this and there might be a few times that we have to loop back. But you want to make sure that it's defaulted here to the state of Texas. Your coverage date is always your original date of injury. The date that the injured employee is telling you is their date. I'm going to choose 10/10 of last year. And the employer that we are going to look up is going to be Tesla. You're going to click search. And when you do, what pops up is all of the Tesla locations in Texas. You'll see that this is one of 92 options. So The injured employee gave you an address and you're going to look for it and oh, it's not here. So you know what? Let's go to the next page and take a look. We'll go down and look. The one that I'm looking for is right here, 1 Tesla Road in Austin. And then I'm going to click on that one. As I click on that, this is what populates. Again, I verify that address. I come over, I make sure that that coverage date, that injury date is still the correct date. And you'll see that it lists the insurance coverage provider as American Zurich Insurance Company. All right, you're going to click here for that claims information. And when you do, this is what populates. Again, you're in TextComp. And this is what I call our jackpot page. This is a page that's giving you all of the information and all of the contact information you would need. So you have claim adjustment information, coverage verification, billing, pharmacy billing, pre-authorization, and even down here, workers' compensation healthcare network or medical benefits plan. So this looks like there's a network involved. And this is where you're going to want to call to verify that your provider is in the network and make sure that all of the information listed here you have verified and checked on. But this is the page that I would want to print off and get into my EMR so that any department who's encountering this patient is able to find this information, verify what they need, and it's right at their fingertips. So I would say that this is your best case scenario and definitely a page that you want to put in to that EMR system so that it's listed and it's categorized there for you and saved so that you have that. So that is our best case scenario that you can hope for when you're looking for this information. Now, you might not always be that lucky. And I'm going to pretend that we said here, oh, you know what? That wasn't the right address. I needed this one. I needed the 1134 Brittmore Road. Oh, so I'm going to choose that one instead. And you'll see that when I choose this one, we now have a different insurance coverage provider. Again, I want to verify that coverage date. I want to make sure that that's verified. Yep, that's still correct. It's still 1010. So now I want to click here for the claims processing information. Again, I'm in TextComp, but instead of getting that jackpot page with all of that information, what I get here is the insurance carrier web address. And you can click on that, and I'll show you that it does take you directly over to Texas Mutual's website. And this just shows that you might not be as lucky and you might have to do some additional information finding and trying to figure out what's going on. And this could be to the point where you're like, oh, geez, I'm going to have to call the employer. I don't know how to get any more information, or I'm going to have to call and try to gather some more information before I can get other things verified. So with that being said, we will head back over to the presentation. And you will see here that what I did was I provided you with a list of every single screen we encountered, where you click, what you see, what goes into each box. As you click on each one, you'll see where you click for the information, where you go when you go directly into TextComp, where you would click in directly in there. I gave you a copy of that jackpot page. I showed you the web URL information, and I also provided this example here. This example may be where you get that jackpot page, but you don't get anything in that network box. You just get a phone number, or maybe it's blank. Maybe you get nothing at all. Again, don't just assume that there is a network or there isn't a network. You want to make sure that you're verifying that there is or isn't a network. Don't just assume, oh, it's blank, or oh, there's a number, there's a network. Make sure you verify that information. All right, so now we're at the point where we have to call the employer, and we're going to ask some questions to the employer to figure out, you know, what's going on, trying to gather information from them. And one of the first questions that you want to ask would be, do you have workers' compensation coverage? This will confirm if they have the necessary insurance for workplace injuries. What is the name of the insurance carrier handling your injured employees? Knowing the carrier helps in directing your next step. So getting that name could be beneficial. Can you help or I'm sorry, can you verify if this carrier is part of a certified network of doctors? It's important to find out if the injured employees need to stay within a specific network for treatment. Remember that. Do you have a phone number, address, or email for the carrier? Remember, this contact information will be crucial for further communication, and then ask about if an adjuster has been assigned to the case. If so, ask for their contact details, and the employer might also have some additional information or maybe a direct contact person who can help assist with the claim as well. So these are some of the main questions to ask the employer that'll help get you answers to the questions that you're trying to figure out what's going on with. All right, now we've covered all of that, and this is a big reminder. If you can't find any insurance coverage information, that does not necessarily mean that coverage doesn't exist. The final step is to reach out to the Department of Workers' Compensation staff for help. You can email them at the coverage verification at tdi.texas.gov. This contact information is listed under that coverage verification portion on that web page. And we'll head back over there and I will show you. Let's see if we can just go back through on this page here. From this unknown portion, this is where you can email us as your last and final step that you take. When you've done your due diligence, if you haven't been able to determine anything and you're still not sure if there is a workers' compensation carrier that would be covering this injured employee, email us. If you click the link here, it will populate an email for you with the address in there. Provide the name of the employer, the physical address of the employer, and that date of injury. Once we receive it, we should be responding within 1 business day to let you know what we have on file. And you can actually take this, print this off, and use this. If any disputes come up or anything about you billing the wrong carrier, you can always say, I did my due diligence and I did check it. So always make sure if you can't find anything, make your last step be emailing us to get that verification information. And since we're already over on the web page, the next slide I was going to talk to you about was our healthcare provider page. We have redone this page. This is brand new, it's recent, and we redesigned it to hopefully make this much more user-friendly and available to you. If you see here, this is where you can contact us at Comp Connection. If you click on that, you are able to contact us here. You can call us. You can click right on our email. With additional news and additional resources are down there for you. The next one is about, you can sign up for our newsletter, our news, and get information on our quarterly meetings here. This one here is, the next block is to become a Texas Workers' Compensation Healthcare Provider. I'll click on that for you. We have our Become a Texas Workers' Compensation Treating Doctor checklist available for you, and becoming a designated doctor or certifying doctor information as well. We did provide you with a video and definitions and training information. Here we have our coverage verification. Remember I said there's multiple ways to get to the same place on our webpage. So you can skip everything I told you, come right onto the webpage and click here, and you'll still get to that page to verify that coverage. This next box is for pre-authorization and treatment guidelines. We divided that into non-network and network, and utilization review agent information. Medical billing details, we've got the general rules for medical billing. We've got pre-authorization on here for you, requirements for paper and electronic billing as well. We have medical billing. Oh, sorry, that's the same one. Medical and facility fee guidelines and information. We have that listed for you here. These are all at the bottom here. Return to work brings you right over to the return to work page. And the last one here is our healthcare provider training and education page. This is where we list our healthcare webinars, the course descriptions. You can come here to the events calendar and find future dates available. And when you click here, these are all of our on-demand videos that we have up on our webpage that you can view as well. So this hopefully is user-friendly. This is a great resource to you. I do find that a majority of questions can be answered. The information's out there, it's just knowing where to find it a majority of the time. But again, if you can't find that information, remember, we are available at ComConnection. You can call us and we'll be more than happy to help you. I did show you the page of our, give you a slide for our webpage. All right. So that sums up how to identify a workers' compensation patient. Let's go over and recap what we've talked about. We discussed the risks of not identifying a workers' compensation injured employee, questions to ask during patient registration, and how to verify an employer's workers' compensation coverage, where to go and how to verify that information. So now we've reached the fun part of our presentation where we put a poll up for you to answer some questions, and we go over and discuss these questions with you. Let's see how well I did at transferring the information over to you. I will put that poll up, and then we'll discuss those questions. The first question is, can you bill the injured employee for all or part of any remaining balance? The answer to that question, remember, is no. You risk an administrative violation if you default any part of any remaining balance to an injured employee. Number two, when verifying coverage for the injured employee, whose coverage are you verifying? Are you verifying the injured employee's health coverage, the injured employee's employer's coverage, or are you verifying both? The answer to that question was the injured employee's employer coverage. Remember, coverage leads back to that employer's coverage on that date of injury. Number three, the coverage date is considered to be the date the injury occurred. That is true. Your coverage date will always be the date of injury. So it could depend on what injury you're looking at. If you have a patient with two injuries and two different dates of service, two different dates, you're going to want to make sure that you're verifying the correct injury date to determine what coverage is needed and required to treat that injury. Number four, if a Texas employer elects to have coverage, they also get to choose what type of coverage that they have. That answer is true. Remember, they get to choose that coverage and they get to choose between those network and non-network options when they're electing to have coverage for their injured employees. And number five, workers' compensation bills in Texas must be submitted within 95 days from the date of service. Yes, there is that billing deadline of 95 days from that date of service when it comes to Texas workers' compensation bills. Keep that in mind. You are on that tight deadline and the clock doesn't reset for corrections. All right, so that summarizes the poll, and thank you everyone for contributing to that today. In our next boot camp, we will be discussing pre-authorization and swinging into pre-authorization, medical necessity, and utilization reviews. You'll learn what the statutes and rules say about medical necessity, and you'll learn about non-network guidelines and how they work. So I hope you keep up your momentum and get ready to swing into action. If you have any questions, you can always contact us at ComConnection by email or phone. Thank you so much for joining us today.